All right, welcome everyone to our fourth installment of the pre-trail webinar series. Today, we're going to have an awesome presentation specifically around training for a hike and injury prevention. Whether that's your first weekend trip or even if you're going out on a through hike, lots of good stuff in here to learn, just to kind of stay healthy out there on trail. We're joined today by Krysta Norwick, who's a GDT Nobo through hiker in 2020. She runs her own blog, Millennial Mountaineer. She's a van lifer and physiotherapist and owner of Cairn Physiotherapy, which is an online physiotherapy clinic. Krysta, do you want to give a bit of an intro?
Absolutely. Thank you so much, Austin. Nice to meet you all if I haven't met you before. So that's a great intro. Thank you. That pretty much covered everything. I did the Great Divide Trail back in 2020. And back when I was actually training for the Great Divide Trail, I tried to find a physiotherapist who could help me because I really wanted to work on my body, make sure I was prepared and prevent injuries if I could. And I had a really hard time finding someone who actually knew what I was asking of my body by doing a through hike for that long of a distance. So I started to get the idea that it would be really fun to be able to help fellow hikers, whether your goal is a weekend hike or a full through hike, so that you know how you can best prepare your body and how you can potentially prevent injuries that we know are quite common with hiking. So I'll share my screen. Sorry, one sec. Okay, it's telling me I need to quit and return to Zoom in order for you to still be able to record the screen. So I'll just be back in a second, sorry. Okay. I'm back. Okay, try that again. Okay, oh, don't need that screen. There we go. Okay, can you confirm you can see that?
Looks great.
Thumbs up, great. Okay, awesome. So for those of you that aren't familiar with physiotherapists, I am a physiotherapist, and we in Canada have a master's degree in physical therapy. And so where our expertise lies is really in how your muscles move your joints and how your body moves. So we are really oftentimes we are known for our injury recovery. So we help you if you've got your aches, pains, you're dealing with any sort of injury. We also can help with injury prevention, which is something not as many people know about. We help with other areas of wellness and disease management, but with this talk, I'm really going to focus on the musculoskeletal system because that's what you tend to have an injury with hiking if that does occur. So your muscles, bones, joints, ligaments, tendons in your body. So whether you're planning your first backpacking trip or a full through hike, I really want to help you reach your goal. So I want to share with you in this presentation today how you can learn about common injuries and then prevent them. So I'll cover common hiking injuries, how you can prevent those injuries, how you can prepare your body for hiking, and then how, with all of this in mind, you can plan an amazing itinerary in order to have the most set yourself up most for success. And then I'll answer questions at the end. If there's any burning questions throughout, please don't hesitate to ask. I will be trying to watch for any that might come up as well.
I can keep an eye on the chat too if questions are coming in, so then we can grab them all at the end.
Okay, that sounds great. Okay, so let's dive into it. So there are two major types of hiking injuries that can occur. So the one type is high impact injuries. So that's usually when you know that you injured yourself. So maybe you slipped, you fell, or you tweaked your knee, and in that instant you knew, oh, something is not quite right here. Those are the high impact injuries that can happen. The second category are overuse injuries. So these injuries, it's usually a lot harder to pinpoint the specific moment when you injured yourself. Usually they come on slowly with time. Maybe you notice every single time after you hike downhill, your knees hurt, or your back is slowly starting to hurt with each hike that you do. And these ones usually show up more with dull aching. They can still be sharp shooting pain, but usually it'll be in the joints, the muscles, tendons, and you can get nerve pain and irritation, and I'll explain that a bit more later. And then skin injuries, which are quite common with hiking. Here's a breakdown of the incidences of injuries in long distance hikers. So this study was actually done back in 2009 on Pacific Crest Trail hikers. And what they did was they examined the different types of injuries all of the hikers reported that they had at some point during their hike. So on the left-hand side of the graph here are musculoskeletal and nerve injuries. So that's injuries to the muscles, bones, tendons, joints, and nerves. So what they found is that the most prevalent injury that hikers reported was paresthesias. And paresthesias are nerve irritations. So that feels like numbness, burning, or tingling in the hands, leg, or feet. So if you've ever fallen asleep funny on your arm and it feels like it's asleep when you wake up and it feels like pins and needles, that's the sort of sensation that you might be feeling with this nerve-related irritation. The second most common one was joint pain. So most of us have experienced joint pain in our life, aching knees, sore back, sore shoulders. And then shin splints and joint sprains were the next most common, and they were tied. And then broken bones are really rare. The only long distance hikers that reported a broken bone reported a stress fracture. So a stress fracture is a type of broken bone that is an overuse injury. So it's not one of those quick ones that happen. It happens over a long period of time, and that's from repetitive use. So eventually the bone develops a stress fracture. And interestingly, the only folks that reported that were hiking in sandals. And then tendon, ligament, and muscle strain injuries were quite low. On the skin side of things, on the right-hand side here, blisters were by far the most common skin injury that people reported. And I think it's easy to underestimate blisters because you can think, oh, I'll just push through a blister if I get one. But if you get enough, or if it turns into a worse type of wound, that can dramatically impact your hike and maybe even end it. So really important to try to prevent skin injuries as well. And I'll touch on how you can do that in this talk. Sadly, when I did a deep dive into the research, there isn't a ton on day hiking. So what I was able to find was a study done on hikers in Hawaii, and I definitely have a lot of anecdotal information from working as a physiotherapist, treating tons of people along the way. So obviously, day hikers can still get broken bones, have serious injuries, probably have some nerve irritation, sprained ankle, those sorts of things. But this study found that most day hikers reported scrapes, cuts, and blisters as their injuries that they received. And then muscle strains and sprains were the most common when it came to the musculoskeletal system. Okay, so now that we know what injuries are the most common, let's talk about how they can be prevented. So what's really interesting is that there are things called risk factors, and risk factors actually can be identified for you individually. Once they're identified, you can address them. And once you've addressed them, you're actually decreasing your risk of injury. And then having an ongoing maintenance plan to keep your risk factors at bay or as low as possible is a really good way to keep yourself protected and have that injury risk be a little bit lower. Of course, you can't prevent all injuries, so I will touch on that a little bit later, but you can decrease your risk for sure. Okay, so there's two major types of risk factors. The first one is internal. Technical word is intrinsic. Internal are internal to your body, so your physical and your mental body. External risk factors are outside of your body, so that can be things like gear, weather, environment. When it comes to your physical internal risk factors, things that we're looking at, especially from the physiotherapist lens, are muscular imbalances and habitual movement patterns. But then we also know that overall health tends to decrease your injury risk and overall fitness level. For the mental side of things, fatigue is a huge factor. A lot of people report becoming injured when they felt really tired or it was way at the end of their day. Ego can also be a big one. So if you notice that ego tends to get in the way of your decision making, maybe you push a bit too hard or a bit too far, or maybe the opposite, maybe you have underconfidence, so you're not feeling confident enough to move through the terrain with confidence and effectively, or maybe you feel overconfident. So checking in with those factors can be really helpful to understand maybe what your tendencies tend to be. I know I tend to be a little bit overconfident, and I have to check myself to make sure I'm not overestimating my abilities. And knowing that helps me in the moment know how to evaluate my thought process. Another really big factor is that probably many of you in this conversation right now are like me, and you love getting outdoors for your mental health. I find it is so beneficial for my mental health. And if I have an injury, an ache, a pain that is deterring me from being able to hike or get outside, I definitely weigh the cost benefit ratio. How is my mental health going to suffer if I can't get outside? And so understanding that can be quite a balance for many people, it is a big factor. That is something that a physiotherapist can help you with as well, understanding what you can still do in order to still give your mental health support. And then for the external factors, what we know in research is that the terrain that people tend to report they get injured on the most is scree and downhill slopes. So if you're linking that with fatigue levels, for example, if you're really fatigued when you're on scree and downhill slopes, that can be an increased risk of injury. Whereas if you tackle those slopes when you're less fatigued and have had well nourishment throughout the day, then you might have a better chance of negotiating that. Weather can be a big one. We can plan for some weather, we can't plan for others. Pack weight, which I'll dive into more detail, other people on the trail, and then your equipment. So how well does your equipment fit you and how well is it maintained? Let's take a closer look now at factors that affect specific injury rates. Musculoskeletal injuries, like I mentioned, are to the muscles, bones, joints, tendons, ligaments in the body. So what we know based on research, and this study was actually done in the Canadian Rockies, which is very GDT specific, these injuries weren't impacted, so injury rates weren't changed by the age of the hiker or the gender. They also weren't changed by the pack weight. But what did impact the musculoskeletal injuries was internal factors like balance and proprioception. So if you don't know what proprioception is, that's your ability to know where your body is in space. So for example, if you close your eyes right now and you lift your arm above your head, you can probably feel where your arm is in space without actually looking at it. That sense that you have is proprioception. It's your ability to know where your limb is in space. And that's really key for injury prevention, because if you're hiking, you're looking around at the beautiful view, or you don't have great visibility or something, and you're not watching each foot step perfectly, you can actually feel where your foot is in space. And so you're able to remain, keep your balance better when you know where your body is in space. Core strength, also, we probably have all heard that core strength is good. It's really protective for injury. Hiking technique can make a difference. Muscular imbalances, so how much you're using some muscles or how little you're using other ones, and some flexibility can play a role. External factors that impact musculoskeletal injuries are weather, the terrain, the ski and downhill being the highest injury rates, and then footwear. What's interesting about footwear is the type of footwear only impacted the prevalence of stress fractures. So type of footwear didn't impact anything else but stress fractures, which is in that PCT study, that those were reported by people who hiked in sandals only. Ankle sprains, actually your risk of spraining your ankle increases with having poorly fitted footwear, but surprisingly not type of footwear. So the better your footwear fits, the less likely you are to sprain your ankle. The next main category is that nerve irritation or pain that I mentioned earlier. So the burning, tingling, or numbness of the arms, legs, or feet. This is the type of injury that is reported most commonly in thru hikers. So there hasn't been enough research for us to know what doesn't impact the rates of this type of injury, but we do know what does impact those rates. So internally, that's in your body, having poor balance or too weak of core or muscular imbalances can impact nerve pain. And then external to your body, your base pack weight and your footwear type can impact rates of nerve pain or irritation. So I'll dive into those in the next slide here. So on the left-hand side is the base pack weight. So your base pack weight, they in this study checked 10 to 20 pounds, and then 21 to 30 pounds, and then over 31 pounds were the base pack weight amounts. So you can see for the 10 to 20 pound group, around 27% of hikers reported having nerve irritation. 21 to 30 pounds, 50% of hikers, and then for more than 31 pounds, around 73% of hikers. And then for footwear, the graph goes down in the opposite direction. So the stiffer, the more supportive footwear the hikers were wearing, the more likely they were to have nerve-related pain or injury. So for hiking boots, around 73, hiking shoes, around 40, running shoes, around 30, and sandals, 25. So to summarize, because pack weight seems to be a topic we talk about a lot, and this is based on the research that we have. So pack weight does impact your risk of developing that paresthesia, so that nerve-related sensation, burning, tingling, numbness in the arms, legs, or feet. What we found so far in the research is that pack weight does not impact your risk of developing muscle and joint sprains, strains, or ligament injury. So what's really important to note is that your pack weight may not necessarily increase your risk of those musculoskeletal injuries, but properly training with your pack before your hike, no matter how long your hike is going to be, is actually the best way for you to decrease your injury risk. So your pack weight matters a little bit less than your actual training plan. And I'm going to break down that training plan for you a bit later. And then skin injury is another category of injuries. So what we know is that your skin injury, specifically blisters, which are the most common, they are not impacted by your foot posture. So I think that is somewhat of a myth buster. I think a lot of people have received that misinformation in the past. So your foot posture shouldn't impact your blisters. Your footwear type also hasn't been shown to impact blister rates. But what has been shown to impact blister rates is higher number of kilometers walked on asphalt. So if you're walking on asphalt, or if you're walking on grass, gravel, trail, you're less likely to get blisters. Wet socks by the end of the day. So of course, changing up your socks when you can. especially when you're hiking in certain sections of the GDT. This picture on the left, I think that was hiking section F. It was just muddy the entire time. No insoles. So if you wear insoles, and they don't need to be fancy, they don't need to be specific to your foot, you can buy ones that are over the counter, like Superfeet. I always send hikers that I work with to running stores because they often have a nice lightweight insole that has a bit of support, and that can really decrease your blister rates, but also foot fatigue, which is really nice, especially on those big long days. And then your fit of your footwear. So footwear type doesn't really matter, but footwear fit does matter. So making sure it fits you super well, no matter what footwear you decide. Now that I've covered all of the risk factors, you might already be thinking of some that you know that you have, or you might not really know if you have any. So I want to explain to you how you can identify your risk factors, how you can address them, both your internal and external, and then how you can implement a slow and progressive training plan and design an excellent itinerary for your hike. And all of this helps you prepare your body and prevent injury. Okay, so step number one is to identify your risk factors. So the way that you can identify those internal risk factors, the number one way that you can do that is to work with a physiotherapist. So a physiotherapist can perform a full assessment and figure out exactly how your core strength is, how your balance is. Do you have any muscular imbalances? How is your hiking technique? I like to review videos of my clients hiking if that's something that they want help with. And ideally, you would look for a physiotherapist who has done the type of hike that you plan to do. So like I mentioned at the start, when I was training for my Great Divide Trail through hike, I really wanted to work with a physiotherapist myself. Even though I am a physiotherapist, it's very hard to treat yourself. I really wanted to work with a physiotherapist that knew what I was asking my body to do. And I think that's it's really quite a special experience to go on a long distance hike. And it is really nice to know that someone has those tips, tricks, and they have the experience of what it's like being out there. So they understand why you're so motivated probably to get out there on trail. And then the other thing that you can do starting today, especially if you're planning a hiking goal this summer, is to reflect on areas that you know are weak for you, maybe tight, or that you've injured yourself in the past. Oftentimes we all know our bodies best ourselves. So knowing which areas tend to give you trouble, you can already start to think about that and see if you can start addressing it now. And then also reflect on your mental wellness, your ego, how's your confidence, how do you tend to think when you're out on trail? And then for your external risk factors, you know now that a heavier pack increases your risk of nerve irritation. So if you know that you're prone to more of that nerve, that numbness, tingling, nerve irritation sensation, then it might be a higher priority for you individually to really get your pack weight down. If you don't really think you're more prone to that, then maybe it's less of a priority for you and you really just want to make sure you have a great training schedule. Everyone is going to be individual with these decisions. You might be thinking about footwear. So we know now that a sturdier shoe tends to increase your risk of nerve irritation. So again, if you know your feet are more prone to that, then maybe you want to elect for a less sturdy shoe. But everyone's going to have, again, their own individual needs. So some people feel more secure with a sturdier shoe and it feels like you have more support and like you're less likely to roll your ankle. And if that's the case for you, then that's probably more of an important factor than decreasing your nerve injury risk. And that is definitely something that you can discuss with working with a physiotherapist as well. But really what you want to really make sure you do is have a really, really well-fitting shoe, whichever footwear you like to hike in the most. Make sure you like it, it fits well, it feels good on your shoe, on your foot, because you're going to be wearing it a lot. And then try to get insoles. So even if it's over-the-counter insoles, they can really help. And then also just thinking about, okay, what terrain tends to be the hardest for you? What weather conditions are you going to need to hike through? Because if you're doing a weekend hike that you had to get a permit for, no matter what the conditions are, you probably still want to go. Or if you're on a through hike, there's going to be times when you have to hike through poor weather. So maybe implement into your training plan practicing in those sorts of weather conditions. Of course, as long as it's safe and managing your risk as much as possible, but maybe increasing your comfort level. And then step number 2 would be to address your internal risk factors. So those are those risk factors internal to you. So for your individual risk factors, so these are things that are going to be really unique to you. Everyone is a little bit different. To really address your unique things, working with a physiotherapist is an amazing way to do that. You can get an individualized training plan and a treatment and exercise program for your physical needs and for your specific risk factors. And you can work on your own known areas of weakness and or past injury. And the sooner you can start working on that, the better. But then in general, based on the research and based on all the work I've done as a physiotherapist with other hikers, there are general areas that you can probably start addressing right away. And just as a disclaimer, not every single exercise is going to work for you. So if something sounds like it isn't going to work for your body, please don't do it. Check with a physio. But in general, these things tend to help. So having strong glute muscles is really protective and supportive for your legs and even up into your lower back. So your glute muscles are the bum cheek muscles. They're on the back of your pelvis, and they're responsible for helping stabilize your pelvis. And they also help you propel yourself forwards at the end of your stride. So having really strong glutes is really helpful. So things like squats, single leg squats, lunges. There's multiple different glute exercises you could try out. Core strength. So having adequate core strength is, again, really protective for injury. So most people have done some form of core exercises before. If you haven't, it's really good to get some guidance on these, but really adding some core strengthening into your routine is a really great idea for hiking, but also for pretty much everything else. Balance and proprioception. So I explained proprioception earlier in the talk. That's your ability to know where your body is in space. And balance, single leg balance, single leg squats. Adding in proprioception would be practicing your balance while changing another variable. So maybe closing your eyes or standing on one foot and rotating your head a little bit so that you're changing your visual input. With those ones, of course, take care, hold onto a counter if you feel like you could potentially fall. You definitely want to make sure you're in a safe environment if you want to try those ones. Ankle mobility can be really helpful as well. So if you know you tend to have stiff ankles, working on that mobility can be really helpful. And then just generally increasing your overall fitness. So if you can start to increase your fitness over the course of the next few months, especially if you're planning your goal in a few months, then that can really help decrease your risk of injury as well. And then to address your external risk factors, at the individual level, I mentioned this a little bit a couple slides ago, but if you're prone to nerve irritation, then you might make decisions about your pack weight and your footwear based on what I've taught you today. Or if you know you're prone to ankle sprains and you want something that makes you feel more secure for your footwear, or using hiking poles, that sort of thing, then that's something that you should consider. Can you afford newer, lighter gear? If you can't afford lighter gear and you have to have a heavier pack weight, then really making sure you implement a very gradual, really solid training schedule is key. And then also, what footwear type do you prefer? Because you want to enjoy wearing your footwear as much as possible. And then in general, plan to reach your technical terrain if you can when you're not at your absolutely most fatigued level. And then practice your comfort level in weather. Step number 4 is training for your hike. So the number one thing that you can do to prevent injury. So I know I talked about all those detailed things before, but really the absolute number one thing that you can do is to properly train for any physical goal, including a hike. Because even if you have lots of different risk factors. If you slowly prepare your body and you give your body time to adapt to the hiking distance, how much weight you're carrying, the footwear, and the type of terrain, then your body is incredible at adapting, strengthening its tissues, and slowly getting it ready for that big goal that you're working towards. So let's dive into how you can do that. And I'm going to be speaking from my physiotherapy knowledge, so how to train your body for any physical goal, and then also from my knowledge as a thru hiker myself and with my years of experience backpacking. Here's a graphic I made to depict a timeline. So today is the trailhead on the left-hand side. This is you right now thinking about your goal of whatever hike you're going to do. And your goal is at the end. I divided it into 6 sections, and that's breaking up your training plan into 6 sections. So if you have a goal in mind, maybe just think about it right now. What are you aiming to do maybe this summer? Maybe it's a longer term goal. And think about where you're at today. And you can actually write it down if you want, type it out, whatever you want to do to follow along, or you can just think about it. I'm going to give you an example of an imaginary person that might be at a certain level today, what goal they're working towards, and how they can get there. So I'm going to change the slide. Okay, so this imaginary person has a goal of hiking, of doing a 4-day backpacking trip. This will be their first backpacking trip ever. Of course, they want to do it on the GDT because it's amazing. And their plan is to start August 1st, and it should be a 4-day trip, distance 55 kilometers, pack weight 35 pounds. And when thinking about today, they're thinking, okay, I have no backpacking experience. I'm comfortable with day hikes of 10 kilometers, and the pack weight I normally carry is about 10 pounds. So what we want to do is we want to break down that goal over the course of their training schedule. So today is, I can't remember the exact date, but it's the end of February. And the goal is starting in August. So by mid-May, they should be at their halfway point for training. And so they should be around their halfway point for their physical ability as well. Usually you want to ramp up your training slowly. And if you do too much too quickly, that's where your risk of injury increases substantially. So it's very tempting to go, okay, I need to be able to do 20-kilometer days. I'm just going to start doing that. But actually, it's better if over the course of that time, you build your way up slowly to 20-kilometer days and you just start doing them right near the end versus starting to do them tomorrow and trying to maintain those for the next 4 months. So what you want to try to do is get to around a halfway point in your training in terms of how much distance you're hiking, and then also how much weight you're carrying. So around mid-May, this person can be kind of built their way up to 15-kilometer days, carrying 20 pounds. And then between that halfway point and their goal, starting to do one-night trips on the weekend. So ideally, you would try to fit in a few one-night trips. If your goal was a 4-day trip, in order to test out your gear. You'll test out your full pack weight. You'll test out likely similar terrain. Maybe not, it depends on where you live. And it'll give you a good sense for how your body responds. And if there's any nagging, ache, pain, anything like that, then you can address it with a physiotherapist then, so that hopefully you can resolve it before your 4-day backpacking trip. It's going to be amazing. My next example is of a thru hiker. So the thru hiker today has experience with 5 to 10-day hikes, and their current fitness is that they've been skiing all winter, but they haven't been hiking at all. They have been carrying a pack weight of 10 pounds when they're out skiing. So their goal is to thru hike the GDT. So it'll be the longest hike that they've ever done, and they want to start in July. And they're thinking their pack will be about 40 pounds. So that gives them a good 4 months of training, which is great. So the halfway point will be around May 1st, And ideally between today and the halfway point, you start walking if you can, and you start doing physio exercises if you've got your physiotherapist taught you what specific areas you need work on. By the halfway point, you should be doing, and of course, this is going to vary individual to individual. So this is an example, but maybe this person would be doing 3 to 4 times per week, doing day hikes, trying to get in 10 to 15 kilometers per day if they can, wearing from today, building their way up to 25 pounds by the midway point of their pack. That's a progressive increase. So depending on where you live, you might be able to do this around town. You might be able to walk on a treadmill. You might be able to do some stairs. You might need to be creative, but getting out for those distances to build your body's resilience when out on those distances carrying that pack weight. And then between the halfway point and the goal, planning at least one trip that can be more of a test trip where you do probably an equivalent to a section hike would be ideal. I know that's not possible for everyone's schedule and all of that. So planning some sort of equivalent where you can combine a few different days of hiking into a sort of practice section hike, not only can help you test out all your gear, make sure everything works well, make sure your footwear works well, but it can also give you a sense of if there's anything, any weak point in your body that starts to bother you. So for example, when I did the GBT back in 2020, I did my training hike a month and a half before I did a 10-day hike on the Sunshine Coast Trail. And I noticed my knee bothered me by day 2, and it was really, really sore by the end. And it was so sore, I was like, there's no way I could complete the GBT if this is how painful it is. I was taking like the maximal amount of Advil you can take per day. It was awful. But I was really glad because I still had a month and a half until the GBT. I saw my physiotherapist several times. We worked on everything, and I actually ended up having no knee pain at all in the GBT. So it was the perfect way to test out my body, see what extra help I needed. So that's an example. Like I said, it'll be individual for you. So maybe take a screenshot if you want so that you can get a sense of what the progression could look like, and then you can play around with what's going to make the most sense for you. And then step 5 for preparing your body and injury prevention is to plan an amazing itinerary for your hike. So here are the steps that I like to follow. The first one is to calculate your pace. So what pace are you comfortable doing? Plan a slow start to your hike or your goal. Schedule in rest days if you're doing a through hike. And if at all possible, allow for buffer time. So for hiking pace, you're going to be the one who knows this best for you. So I knew that based on previous hikes in alpine type terrain that I was pretty comfortable hiking 25 kilometers in 8 hours. So I thought I could probably do 25 kilometers per day. So I took the total number of kilometers I needed to hike, divided it by my average kilometers per day, added in the rest days, and then I got my total number of days that I thought it would take for me to do the GBT. Of course, with the GBT and permits, that did change a little bit. There were a few days I only hiked 10K just because of my permits I was able to get. But overall, I stuck to this relatively well. So for my hike, my average kilometers I planned to do was between 20 and 30 kilometers per day. If you're curious to look at my full itinerary, you can find it on my blog. I put the link here at the bottom, but it's millennialmountaineer.com. So I planned a slow start because I knew, even though I trained pretty well, that my body would need time to be introduced to through hiking, because there's nothing quite like through hiking than through hiking. So you can train, but it's not quite the same. So I decided, okay, I'm going to try to do less than what I know I can do per day in my first section. So in my first week, I did 15K, 15K, 22, 20, and 20. So I always stayed under my 25 average amount. Had a rest day. And then in section B, I did 25, 30, 28, 22, etc. So I went back up to my normal distances in week 2. That worked super well for me. You might need to change that a little bit depending on how, what your needs are, permits, etc. So for example, if we're going back to that example of the person who's planning their first ever backpacking trip, 55 kilometers over 4 days, you can also plan a slow start in a 4-day cycle. So maybe day 1 is 10K, day 2 is 12, day 3 is 15, and day 4 is 18. I like this because you slowly ramp up, but also you're doing a little bit more distance when your pack is going to be lighter because you've eaten all your food, or probably close to. Of course, with permits, this might not be possible. So there might be some fluctuations, but keeping this in mind to see if you can have a shorter first and second day or so can be a really great way to do it. So based on all of the information that I provided you, if you are to remember anything, slowly introducing your body to every activity, including hiking, will dramatically decrease your risk of injury. So the training schedule and the slow introduction of your body back into hiking for the season. So even if you're a seasoned hiker, if you're getting back into it for the season, slowly reintroducing your body and slowly introducing your body when you start whatever trip or goal you're working on. That way your body has time to adapt and you're less likely to develop an injury. Now, injuries do happen. So even when you've done your absolute best, you've addressed your risk factors, you've worked with a physiotherapist, sometimes they still happen. We cannot prevent every single injury. And I just want to emphasize, it's okay, we got you. An entire profession exists to help you with this. That's physiotherapy. You can contact your physiotherapist ASAP. At Cairn Physiotherapy, which is my clinic that I own, you can even send us an in-reach message to our email, and we can, if we've worked with you before and we know your body, we've done an assessment with you, then we can correspond with you over in-reach while you're out on the trail. Of course, if it's a medical emergency, we're not the ones to call, but if it's a quick physio tip or question, we can definitely respond. And what's really important to note is that early physiotherapy is actually associated with decreased overall length of injury, pain, and impairment. So the sooner a physiotherapist is involved, likely the sooner you can get back to doing what you love, being on trail. So where can you start? This might feel a little bit overwhelming, lots of different information to process. So where you can start right now, today or this week, is to get clear on your goal. Get clear on how far you want to go, what date you want to start, and start to set your plan, rewinding back from that goal. Decide which footwear you will use. So you want to make this decision as soon as you can, because you can practice with that type of footwear, make sure it works for your foot. And if you know you're going to choose a certain type of footwear, then you can also address the other risk factors that could be associated as well and really prep your body that way. Decide on your pack weight so you can slowly start increasing it over your training plan. Plan your training itinerary and start this week if you can. And the other option you have is to sign up for our hiking prep program, and you can get help from the professionals. So our hiking prep program was designed by myself, and we designed it specifically so that all the extra work of you figuring out what your risk factors are, planning your itinerary, planning your training schedule, we do that for you, and we just give it to you so you can follow it. So what we will do is match you with the right physiotherapist. So if you're a day hiker or a multi-day hiker, there's a couple of us that can help you. And if you're a through hiker, I would be the one helping you. So we identify your physical risk factors for you through assessment. We address those risk factors by providing you with physiotherapy treatment and exercise if you need. And then we create a personalized hiking training plan for you, assist you with the creation of your hiking itinerary. We can even assist you with gear selection based on your physical body, if that's what you want. Provide you with additional resources exclusive for hiking program participants. And that includes workbooks if you like to stay accountable. And of course, we can support you while you're out on your hike if needed. Depending on your individual goals, the amount of sessions you'll need with your physiotherapist will probably vary. So it's best if you can send me an email, Krysta@cairnphysiotherapy.ca if you're interested. We can chat back and forth a little bit and figure out what's going to work best for you. And it doesn't matter where you're located because we see people online, so we can help you right from your home over a video call. And I just wanted to highlight one of our hiking prep program participants last year. Tanya wrote us a really wonderful review, a GDT through hiker from last season. She participated in the hiking prep program and felt confident and physically prepared to go out on the 7-week through hike. And this is the review that she wrote us. So great work, Tanya, and thanks for the great review. Okay, that's the end of the presentation. So I put down all the different places you can find me if you want to find me on social media. If you want to see my videos of my through hike back in 2020, they're on my Millennial Mountaineer YouTube channel. And then if you want to be in touch with me about the hiking program, you can email my physiotherapy email and I'll write it in the chat as well. And yeah, I can answer any questions that people have now.
Awesome. Great presentation, Krysta. Thanks a bunch for that.
You're welcome.
I did get a couple questions from people that couldn't make the meeting today. I think they were going to watch it on YouTube, but they wanted me to ask this. Do you have any tips for avoiding cramps on trail, and kind of what can we do to, I guess, mitigate them? And then when we do get them, what's the best way to kind of keep them off for the day if we can?
Yeah, that's a good question. And it is a tough one because we don't 100% know fully how to do that. But really the one major thing is hydration. So ensuring you're drinking enough water, nutrition also, making sure you have enough food. There could be an aspect of maybe your muscles feeling like they're overworked. So the training process could potentially help decrease your risks of developing cramps. But then there also can be an aspect with cramps of nerve irritation. So if your nerve that's supplying the muscle is actually a little bit irritated, and then your muscle is more prone to cramping. So that could be maybe associated with pack weight and footwear potentially. But again, we don't know with 100% certainty. If you are experiencing a cramp though, oftentimes a good way to mitigate it in the moment is to actually stretch that muscle. So if you're someone who knows your calves cramp, make sure you know how to put it into a slightly stretched position. So usually that's by keeping your foot flat, but then driving your knee forwards, and that'll stretch your calf a little bit. And that a slightly stretched position can help it from cramping further and feeling like it's really locking up. And if it does happen, maybe take a break, drink some water, have a snack, and later that night, you may want to do a little bit of stretching of that muscle as well.
Cool, thank you. And then Curtis has a question. I'm curious what you think about using a stationary bike for winter training, as it's been really icy here and I don't have a treadmill. Could it create muscle imbalances or other issues for hiking?
That's a great question, Curtis. So stationary biking is amazing for working on your overall fitness and your cardiovascular fitness, especially if you do any, firmer resistance. It doesn't have to create muscular imbalances that can create issues for hiking. But one thing you'll want to check is to see if you're actually using your glute muscles when you're riding your stationary bike. So one way to check that is to literally just like hold your butt cheek muscle and see if you're actually feeling it clench as you're riding. But a trick that is actually quite helpful is as you bring your knees, I'm going to try to show you with my hands, but imagine you're biking and these are your knees. So you're coming up, your knees are moving up and down as you move the pedals. If you actually allow your knees to come a little bit inwards at the top of the pedal stroke like this, that'll actually help you activate your glute muscles more, which your glute muscles are super important for hiking and really helpful for injury prevention. And generally, if you're not letting your knees come in a little bit as you're riding, oftentimes you're using your quads a little bit more, and having really strong quads and less strong glutes can be a risk factor for developing knee injuries. So those are my thoughts with that. I definitely think once the ice thaws, if you can get out hiking then, and you've also been working on your fitness through stationary riding, that's a really good combination. But then in addition to that, maybe working on your balance, working on your core strength, working on single leg squats, for example, if that feels okay, those can all be helpful for you to maintain those more hiking specific movements while you're still riding the stationary bike.
I have another one here. What kind of equipment do we need for training at home?
So you can really train with nothing specific. You just have to get creative. I think if doing core exercises, oftentimes a mat that you can lie on is nice, but it depends on your floor. How I actually trained for my GDT is I was training at home. I didn't have any free weights. I didn't have anything special. I just used like my laundry detergent bottle and a bag of rice and things like that to do a little bit more resistance training for strengthening my glutes and things. But really, your functional training for hiking is going to look a lot like hiking movements and what you'll actually be wearing when hiking. So most of us have done some squats before. So if you're thinking, okay, I want to strengthen my glutes, I'm going to do some squats, that's going to be good. Something that could be really helpful and incredibly functional would be for you to actually wear your hiking backpack with like an item in it and do squats that way. That's going to be a lot more actually specific for your goal than if you're holding like a kettlebell or free weights. It's helpful and it's easier, but it's actually really specific to where your actual backpack that you're going to use. So overall, you don't really need any specific equipment, but really if you're unsure what exercises you can do, getting that guidance from someone who can help you is key.
When I was training for my hike, that's funny, I basically just filled my backpack with what was going to be in there, and then I was just doing like one-legged squats, and I couldn't do that many at the beginning, but I found it helped a lot.
Yeah, that's great. Yeah.
Corey asks, so you're saying fit of a shoe is more important than type of footwear. I'm asking as I've been using traditional heavyweight hiking boots versus lighter weight footwear, and I'm looking to make the transition to lighter footwear.
Yes. Was there a question there?
Not necessarily, but I think maybe, do you have any tips for people moving from boots to say like trail runners or something?
Yeah, so yes, if you are someone who's tended to use really stiff boots most of the time you've hiked, then your feet and ankles and legs are going to be used to that. So going from stiff right to something that's less supportive is going to be a bit of a shock for your body. So making a slow transition is probably the best way that you could do it. So say you're comfortable doing 15-kilometer hikes, maybe start only part of your hike wearing the less supportive shoe. So if you still have boots, you could wear your boots for like 75% of the hike and then try the less supportive shoe for just part of it. Make sure that goes well. And then you can change that percentage over time. So maybe 60-40, 50-50, and slowly transition your body to be able to use the less supportive shoe. That's probably the most safe or cautious way that you can do it, because you are going to be strengthening your feet and ankles a little bit more, and the muscles, all the smaller muscles in the feet and ankles, are going to need to get used to that different type of footwear.
Would you say that's related to people switching to zero drop shoes too? Like I know tons of people use ultras, and switching to zero drop shoe can be a bit of an adjustment.
Yeah, it really is an adjustment just because your body's not used to it. So not just the muscles are changing, but also the tendons that the muscles attach through to your bones. Everything is just, you're putting your load on that foot or then that ankle slightly differently than it's used to. And so your tissues of your body need to adapt to that new, slightly different load. And so they can actually strengthen into that different type of shoe. But again, it takes time. So if you were to just start doing them right away a long distance, that's going to be a lot harder than if you slowly wean into them.
I see Doug asked a question. Shin splints are a real common injury for a lot of long distance hikers, and they often creep up without warning. What are some ways once you got shin splints to help lessen the pain and keep you going?
Good question. Yeah, they're super common. And I actually have heard from a lot of thru hikers that they wear hiking shoes or runners because to prevent shin splints. But I was surprised when I looked at the Pacific Crest Trail study that they didn't find that footwear type impacted shin splint rates. So I'm sure there needs to be more studies because there's not a ton of studies done on thru hikers. So I think that footwear type, like a quick change, regardless of what type you're using, could potentially impact that a little bit. But if you just notice them pop up on your hike, I'll explain what shin splints are a little bit. So your one muscle in your lower leg is called your tibialis anterior. And that muscle attaches along the outside of your shin bone. So on your right leg, it would be on the right side. And that muscle is responsible for dorsiflexion of your foot. So I'm going to imagine that I live in a van, sorry, so I don't have a lot of space, but imagine this is your shin, this is your foot, and tibialis anterior is responsible for this dorsiflexion movement. So lifting your toes up. Of course, you do that movement a lot as you hike. You're lifting your toes every single step to clear whatever's on the trail. Generally, shin splints are an irritation of that muscle or that tendon. So that muscle or tendon is annoyed, it's worked really hard. And oftentimes when a muscle has been working really hard, it gets really tight and it gets sore. So one way that you can combat this one on trail is to actually massage your tibialis anterior. It's worked really hard, so you don't want to do like a deep tissue massage, but you can do a gentle massage where you're basically easing any of the tension in that muscle. And you can feel along the length of the muscle and find if there's anywhere that feels really tight and sore and give it a little extra love. Of course, getting a physiotherapist to show you specifically how to do this on your body is the best way. But I'll write in the chat here the name of the muscle if you want to Google it and take a look. And of course, it's that dorsiflexion movement, so lifting your toes up, that tends to irritate it more. Then if you can, so if you're on a rest day or if you're able to not walk as much, trying to limit that movement as much as you can. So you'll notice it as soon as, now that I pointed out, oh yeah, I really do use that a lot. So you might be able to notice it and minimize it while you're at camp, while you're resting, while you're on rest days. Give a little massage to that area, and hopefully that will start to feel a lot better. It should help, but again, if you're unsure if it's really not helping, then definitely checking in with a physiotherapist is a good idea.
Another question somebody sent me to ask during the webinar is, how can I tell if my gear is fitting properly? I think a lot of people order, say, packs, because so many of them are made in the States that they might order a couple and see what fits best. What are some ways that we can kind of preemptively avoid injury by telling how it fits without necessarily taking it out for a hike?
Yeah, that's a tricky one. I think really getting someone to help evaluate your fit is a really great idea. And there's a few different types of gear, but if we're talking about backpacks specifically, ensuring that the pack is the waist belt is going to sit on the top of your pelvis so that your load is going through your pelvis. The torso length looks good for your torso, and the straps aren't really digging down, or there's not a huge gap between your body and the straps. Again, it might be useful to get someone who is an expert in either gear or the physical body, or gear and the physical body, to look at it and tell you how it looks and how it feels. But a really good way to test how it feels just right away is to actually pack pack up all your gear, put it on, walk around the house, see how it feels. Do you have any spots that you notice right away? And then unfortunately, the only way to know for sure, even if I were to evaluate your gear for you and tell you, okay, yeah, I think it looks really good, the only way to know with absolute certainty is for you to actually try it out on a hike. And so usually you can't return it once you've done that. But really, once you've put in the kilometers and your body gets tired and everything shifts around a little bit, that's when you can really know if it's fitting you well. And you can always make little adjustments too as you're out there and see, okay, if I tighten these straps or if I tie my shoe a little bit differently, does that feel better? If I try different socks, does that feel better?
Thank you. And last one I had was, what are the pros and cons of using trekking poles? And I think this is coming from somebody that doesn't use them currently.
Okay. I kind of love this question because when I dove into the research for trekking poles, I was really surprised at what the studies have shown so far. So the use of trekking poles have been associated with a decreased report of muscle soreness that day and the day after. So if you're using trekking poles, you're less likely to feel like your muscles are sore. But interestingly, people who used trekking poles also reported rolling their ankles more frequently. I thought it would be the opposite. I thought people would roll their ankles less frequently. But there's compounding variables when it comes to hiking research. So usually people who choose to use hiking poles, oftentimes those people have had ankle injuries in the past. And the fact that they've had ankle injuries in the past make them more prone to developing an ankle injury in the future. So I think the research is still a little bit not quite all there yet. So I would say from my experience as a hiker and as a physio, I think hiking poles are incredibly helpful for helping you disperse your body weight a little bit, helping with balance on uneven terrain, so decreasing your chances of falling, also helping you feel less sore in your lower body, especially when you're on a multi-day hike. And then they can also serve dual purpose, like as tent poles, so that'll lighten your load. If you're decreasing your pack weight, that means you're decreasing your risk of nerve-related injuries. They could also act as, a splint when you're out there for emergency first aid purposes. So I overall really, really like trekking poles, but I've also been on hikes when they were just kind of more of a nuisance than helpful. But you can usually always strap them to your pack in that case too.
Awesome, thanks. I see Sarah has a question. Do you suggest a stretching or mobility routine while on trail?
Good question. I think it is, okay, so first of all, first part answer to that question, for injury prevention, strengthening has been found to be the most effective. So strengthening certain muscles that likely are weak on most people, but also may be specifically weak in your own body. However, when you're out on trail, you're using your muscles a lot. So your muscles do tend to get tight and stiff. Everyone's going to be a little bit different in terms of what feels stiffer or tighter based on your own body, and then also your hiking technique, your footwear, all of that. So if you could develop a stretching routine that feels good for your body, that might be really helpful for you to implement sometimes on trail. That's something, again, that working with physiotherapist or somebody who can help guide you can be helpful. But in general, we're using our legs a lot while hiking. And for example, for me to ward off that knee injury that I was feeling, I actually massaged my quads, the outside of my quads, probably every second night when I was in the tent. And I found that was really helpful. I guess I can't say for sure that it actually helped with the injury side of things, but mentally I felt like I was doing something to help. So it definitely was still helpful. So yeah, knowing if you have an area that tends to get stiff, tends to get sore, maybe having a little routine that you can go to, stretching your quads, stretching your calves, your glutes, all of those muscles you're using a lot. If you know you're prone to shin splints, you could start massaging that tibialis anterior muscle along your shin well before you notice any sort of shin splint irritation, because you're actually preventing it throughout your hike in that case. So if you know there's a spot that you tend to deal with, maybe just starting to do some gentle massage early before you ever notice any signs of irritation or aches and pains.
Awesome. And Barbara asks, some long distance hikers believe that hip belts restrict our hip rotation needed for hiking. What are your thoughts on this?
Oh, interesting question. I haven't heard that one before. So hip belts should be sitting on your pelvis. And when hiking, your pelvis shifts side to side as you weight shift over, and there will be a little bit of rotation. But ideally, if you're hiking using your glutes, you're actually going to be doing hip extension. So that's where your leg comes behind you instead of pelvic rotation, which would be your body sort of twisting for you to get that propulsion. So ideally, you're actually not rotating or twisting a whole lot with your regular stride. Of course, that's going to change a little bit depending on the terrain and what you're negotiating. But ideally, your pelvis shouldn't really need to do very much rotation. But also, if it does, your pack will move with you. So from a physiotherapy standpoint, a hip belt should not limit your movement required for walking of your pelvis, and it definitely should not alter anything with your hips, because your hip attaches to your pelvis and your hip belt should be well above that point. Now, one thing that I have noticed, and again, this is more anecdotal, but I have seen that some hikers, especially with heavier packs, can experience a little bit of nerve irritation at the top of their pelvis from the hip belt. So I've helped people with that simply by just helping them adjust their hip belt so that it fits their hip a little bit better. But also, I'll just see if I can show you this. I'm gonna move my table a little bit. Okay. Oh, I'm gonna stop blurring my background. Okay, so at the top of the hip here, this is the top of the pelvis. This is where your hip belt should be sitting, ideally. There's a muscle that runs right along the top here as well. And then there's a nerve that runs down and supplies the outside of your quad. So that nerve can sometimes get a bit irritated just from pressure. So that could be something that you notice with wearing the hip belt. You notice it might even feel, because it's hard to tell exactly what you're feeling in your own body, it might feel like hip flexor is sort of irritated because that's sort of in that same line. And so it might actually just be compression on this one nerve that supplies your skin in the area, doesn't supply the muscle. So like I said, adjusting your hip belt a little bit, making sure it's fitting well, but then also sometimes actually doing a little massage along the top just because of your muscles are a little bit tight can help too. So that's something that if you know you have been prone to that, you could add into your routine. That's the only thing that I've seen hikers experience with the hip belt specifically. So yes, to round out the end of that question, the hip belt should not impact your ability to actually move in the way that the human body should move with walking. I hope that helped.
I have seen a few pack companies too that have like a really articulating hip belt. I don't know if that's the reason why. Like I know the Arc'teryx packs do that, where you can actually like move the hip belt like that. I think that's more for when you're leaning over, but
yeah, that's actually, I have that pack, the Bora, that has that, and I really like it. It helps, I think, a little bit more with how your core and your trunk responds. So your pack can sort of move a little bit so you don't have to use as much core strength.
Gotcha. And then kind of another question, what are your thoughts on using a cork ball for massaging?
Love it.
Stuff out? Okay.
Love it. Cork balls are super light. They're perfect. Yeah, I love them.
All righty. I'll give everybody a minute or two to think of another question. One thing I did want to update everybody on regarding the GDTA. If you haven't seen, we launched our alumni page. So everybody that's hiked the GDT, you can go and you can log your hike any year that you've done it. It really helps us have an idea on how many people are starting and finishing the trail, the average duration. From there, you can sign up, and we have finisher patches available now too, which is super awesome. We have a GDT patch, and then there's a thing below it that says finisher. And then we will have some more merch coming in the near future, so keep your eyes peeled for that. That's the link to it if anybody's interested. And then, yeah, any other questions, let them fly.
I'm also putting my email because I know asking health related questions in a public space is not for everyone. So you're all welcome to email me with any questions you might have too.
Awesome.
I'm excited to see this merch.
It should look good. I'm excited about it.
Nice.
Yeah, bit of a personal endorsement. Like, my partner used Krysta as her physio. That's how I came to know her. And she experienced a lot of like neck and back pain hiking. And I mean, she had light gear, everything else, like fitness was fine, but she was totally fine on the GDT. So massive personal endorsement.
Yeah, it's awesome.
Alrighty, well, if anybody doesn't have any other questions, we'll wrap it up. Oh, that's awesome to hear, Katie.
Oh, that's great, Katie. Thanks for watching.
So yeah, anybody has any other questions, feel free. Otherwise, we're going to wrap it up. I'll post this up on YouTube in the next day or so. Feel free to leave any other questions in the comments there. I'll provide a link to Krysta's website and her contact on the YouTube description if you want to reach out to her. And yeah, everybody, thanks for coming again, and hope you have an awesome summer out on the trail.
Thanks, everyone.
Thank you.
And thanks again, Krysta.
Oh, you're welcome. Thanks for having me. Have a good one.
Thanks.